Hello, welcome to my YouTube channel, Chronic Care Exercise Physiology Services. My name's Amjad. I'm an exercise physiologist practicing out of Sydney, Australia, and I specialize in neurological rehabilitation and complex disability. So today I've got a really exciting review article that was published in 2019, and it's going to look at the effects of exercise on animal models of MS and the central nervous system outcomes. Now, the reason this is really exciting is because most of the evidence talks about the effects of exercise on peripheral and systemic outcomes such as cardiovascular fitness, muscle strength, balance. They don't talk about the central nervous system, which is the spinal cord and the brain microenvironment, and what's happening in multiple sclerosis in terms of the disease state and how exercise can improve the pathophysiology. So what's happening on a cellular level. So I'm going to be, just a disclaimer, it's a very long article, so I'm going to be looking away lots of times and going through the article and reading out to you some really interesting findings, but then my aim is to try and break that down for you and explain it to you in a way that everybody can understand. So the article was written by Ling-Yi Gao, Brian Lozinski, and Voon-Wee Yong, and I'm going to leave a link at the bottom of the description at the end of the video for anyone who's interested. Now, this article is going to discuss evidence in preclinical MS models, mouse models, that exercise influence oligodendrocyte proliferation and repopulation, remyelination, neuroinflammation, neuroprotection, axonal regeneration, and astrogliosis. Now, they're all really big words and jargon, so I'm going to try and explain each of them step by step throughout the article and what all of them mean. But first of all, I think it's important to just do a brief explanation of what MS is and its disease state, because that will then lead the way to why we're talking about these certain things and why exercise influences those things I just mentioned. So MS typically affects a younger cohort of patients, and usually more women than men, and it's a chronic inflammatory autoimmune disease where the peripheral immune cells enter the blood-brain barrier and start to attack the myelin sheath. They start to attack the axons. They cause progressive inflammation and axonal degeneration. So what is myelin? Myelin is just a sheath of fatty tissue that surrounds the axons, and axons are the nerve signals that go from the brain all the way to the effector organ or the muscles to stimulate the effect that we want, whether it's movement, contraction, whatever. Now, myelin is really important because it helps insulate the axon and it helps prevent any ions leaking so we don't lose the strength of our electrical signal from our brain to the muscle. And in between each of the myelin, you have little gaps that have highly concentrated ion channels which carry an electrical signal to allow the electrical signal to propagate from the top to the bottom. So when the myelin gets destroyed, you have an increase in leakiness of these ions, therefore you have a decrease in the strength of the electrical signal, so the electrical signal gets weaker and eventually doesn't even make it. And once the myelin is completely destroyed, the central nervous system, the inflammation starts attacking the actual axon, and we lose that connection altogether. And of course, there's different types of MS. So the most common type is relapse-remitting MS, where you have an acute attack, an acute inflammatory attack, and we have our symptoms, and then there's a period of time where you gradually get better till you make an almost full recovery or a full recovery, and you have a period of time where you're in remission, and then there's going to be another attack. Now, the time period between the attacks can be months, can be years. It varies greatly between patients, but eventually what happens after 1 or 2 decades, the relapse-remitting MS patients develop secondary progressive MS, where there's no more relapse. It's a continual progression of decline. And then another category is progressive, primary progressive, not secondary progressive, primary progressive multiple sclerosis, where there is no relapse period to begin with. So you're constantly getting a decline in function where there's no relapse period. Yeah, so it goes on to, the article goes on to say that most of the medicine, the effective medicine we have at slowing the disease, is targeted at relapse remitting patients. There's not that much that we have for the progressive types of MS patients, and it suggests that exercise is in part, at least, an answer to part of the therapy for MS patients. So the first thing we're going to talk about is briefly just talk about the animal models in MS. So animal models, the reason we use mice is because physiologically they resemble humans. Not exactly the same, but we can correlate some of what happens physiologically within the mice and correlate it to humans, and then do clinical studies. So the most common form of MS models in mouse studies is EAE. So that's experimental autoimmune encephalomyelitis. So basically autoimmune inflammation of the brain, because that's what we have. We have an immune attack infiltration into the central nervous system that's chronic and progressive. Now, the only problem with that is that in these types of models of MS mice, it gets to a stage where they become so advanced that they can't even engage in exercise, and we can't study the effects of exercise on them. So there's other models of MS models of mice that mimic certain aspects of what's happening in MS. For example, demyelination without the chronic inflammatory side of things. So we can inject them with toxins such as cuprizone and lysolectin that replicate and cause demyelination, but they're still able to exercise. So we can examine the effects of exercise on remyelination, oligodendrocytes, and other central nervous system microenvironment.